So joining us live to talk about this, a research scientist at University of San Francisco, Jeremy Howard. Good morning, Jeremy. We read your article that was in the Washington Post, and now it's received a lot of interest over the past 24 hours. So tell us right now why you believe that we should be wearing masks.
Well, let me tell you your words you just said. You should wear a mask. You don't need to wear a mask if you're healthy, but 50% of people that are infected have no symptoms. So how do I know if I'm healthy? The answer is you don't unless you've been tested. So if you don't know, you've got to assume that you might be infected. So if you're not wearing a mask, you could infect all the people around you.
Right. So for you, it's a simple mathematics equation, right? I do want to ask you, of course, in Asian countries, mask wearing is the norm and not the exception, right? So wearing one is a sign of good hygiene rather than a neon sign that you might be sick. So I'm wondering, does data there out of Asia suggest that, yes, wearing masks and, everybody doing so has slowed the spread or kind of helped contain this in those Asian countries that did it?
Yeah, very strongly. So I'm a data scientist, and looking at data is what I do. And here's what the data says. There are 4 countries that are bordering China, the original epicenter of this pandemic: Mongolia, South Korea, Taiwan, Hong Kong. And in all of these regions, as you say, everyone wears masks. In these regions, the death toll is hundreds of times less than in other countries. And furthermore, on the whole, their economies are doing much, much better because they can keep going about their work. This doesn't prove anything, but the way I see it is, here's a recipe for something that works. Why don't we follow their recipe?
And Jeremy, just so we are clear, you're not suggesting that people should be wearing N95 masks, but you're basically just saying anything that is a mask could be better than just going out without one.
Yeah, so here's my mask. I'm not much of a crafter, but I cut it out of a T-shirt. Following a recipe shown by a Czech video logger, a Czech Republic video logger. See, in the Czech Republic, there was a huge social media campaign to make this happen, and within 3 days, they went from 0% usage of masks to 100% usage. So in the Czech Republic now, all my friends there are telling me, if you go in public without a mask, or A, the government's now actually made it illegal, and B, everybody's going to think you are mean as anything because you're putting everyone at risk.
That's right. Irresponsible is the thinking there.
Totally
right?
irresponsible.
So
and what's more, we've looked, sorry about that.
No,
I was just going to say, what's more, we've looked at 38 scientific papers. And again, there's not like the perfect science here. Somebody hasn't said, hey, nobody in this city is allowed to use a mask. Everybody in this city has to. There's no perfect trial. But the 38 papers we've looked at all strongly point to the idea that when you speak, droplets fly out of your mouth, you can't even see them, a layer of cloth protects the people around you and protects you as well.
I'm going to take this off now. A friend of mine who's in the Bay Area actually makes them. I think she calls it like Air Sanity, and it's made of cotton, and she actually made it before this all started. But I don't wear it all the time. I tend to only put it on when I'm going shopping or, if I have to, I would think take transit, which I don't. But shouldn't you only wear it in places where you're going to be exposed to a lot of people who might,
exactly. The people in your family, you're already around them all the time. You don't need to wear masks with them all the time. But when you're any chance of coming within 6 feet of somebody that you don't see all the time, wear a mask. And here's something really, really important. When you come home, careful how you take it off because it could infect your hands. Wash it with soap if it's a cloth mask. If it's a paper towel mask, throw it away and then wash your hands again. Yeah,
something I didn't know until today, Jeremy, was that you should be taking your mask off from the back. So in other words, from the elastic bands.
The elastic?
Don't touch the front.
Yeah, because you're breathing, right? And so if you're breathing in infected particles, it's great they're not in your nose and mouth, but now they're on the mask. So, be careful.
Can I add?
Let me ask you this. When I went onto the World Health Organization today, they are still advising that you only have a mask if you are someone who's caring for a person with COVID-19 or if you feel you have symptoms yourself. Why do you think that message is still getting out there from the majority of our health officials? What's the motivation?
Sure. So it's largely a ambiguity caused by health policy issues. It's not science-based. The ambiguity is this. You should not have an N95 respirator at home. If you do, you are taking it away from hospital workers that need it. The reason they need it is because they do things called aerosol generating procedures. Like when you do intubation, it actually makes the virus airborne. Unless you have a home surgery, you don't need an N95 mask. Unfortunately, WHO has not been specific enough and said, don't wear an N95 mask. They've just said, don't wear a mask. So it's an ambiguity, and it's caused a lot of confusion to the point where the US Surgeon General has actually come out and said masks don't work, which is absolutely, we do not have any science that in any way suggests that.
I wonder if this shift towards more acceptance of wearing, say, cotton masks or just a mouth cover when you're out in public, does that correlate to also a shift in thinking about the way the coronavirus is transmitted, in that I've been reading things over the weekend about maybe it does stay in the air, you know, tiny mist particles that you walk through that area a couple minutes later still hanging there. Can you talk about that?
Yeah, absolutely. So the science in the West has changed. The science in Southeast Asia, not so much. So even Dr. Fauci was saying in early February that this illness is transmitted even when you're asymptomatic. And, you know, in China, there was a lot of information. It's taken a long time to get to the West, but Western scientists are now recognizing, and I've actually been getting a lot of information from folks at Stanford and MIT, including a Nobel laureate, Harold Varmus, who is saying when you talk, tiny droplets are ejected from your mouth. They can go over 6 feet. So in that situation, when you don't know who's infected, you're putting yourself and your community at risk if you're not wearing some kind of mask.
One of the arguments against using a mask has been that it gives us a false sense of security. What do you say to that?
Well, you know, I would recommend people use seatbelts when they're driving, hard hats when they're at construction sites, and condoms when they're having sex. Even if it gives you a false sense of security, I want to be as safe as possible. I find this argument makes an assumption that Americans are so inane and stupid that just doesn't line up with my understanding of real-world people.
Do you think part of it was just because we had such a shortage of masks, especially at the beginning of this pandemic, and that it could have possibly been our leaders, political and health, trying to protect us from that shortage in a way?
Oh, yes, I absolutely believe this is entirely well-meaning. Personally, and I've spoken to a lot of health policy experts who agree, the idea of lying to people is not a good way to get people to do the right thing. I don't think the US Surgeon General should have said they don't work when they do, because now we actually know we need them. We're going to have to turn around this whole discussion.
Okay, so Jeremy, how can we go about it? We now know that perhaps it could be somewhat beneficial to have the mask, especially when you're out in public, but we don't want to even take away the cloth masks because people are making them for, you know, healthcare workers. So what can we do to not contribute to the problem but still protect ourselves? So 2 great ways. The first way is with a T-shirt, as I've described. Cambridge University has found that 2 layers of cotton is fantastic at protecting people. Shenzhen hospital scientists have shown that paper towels are fantastic. So Hong Kong Consumer Council has an official recommendation showing how you can make it with paper towels at home. I've got a method that uses a T-shirt and paper towel. I'll actually be putting a video teaching people how to use that up on my site later today. So if you share it with your viewers, then maybe they can check that out. All right, Jeremy Howard from University of San Francisco, advocating masks for all. Thank you so much for your time and information.
Thanks, Jeremy. That was very interesting.